Happy lunchtime, Georgia. This is Dexter. Hope everyone is doing well. My name is Dexter Brooks, and I want to thank you for the opportunity to talk with you today about the basics of Medicare during our weekly sessions for Lunch and Learn. For many, Medicare is like a new language. It starts with learning words and putting them together into sentences. Gradually, you become more fluent. At United Healthcare, we try to simplify this process through our Medicare Made Clear program. We hope you'll walk away today with a new vocabulary and a clear understanding of what Medicare is, how it works, and most importantly, how it could work for you. Next slide, please. These are the top 10 Medicare questions we hear from people around the country. We'll try to answer them for you today. First, we'll define what Medicare is and who is eligible for it. Next, we will talk about Medicare if you plan to work past 65. Then we'll look at the different Medicare coverage options and cost. After that, we'll touch on how to choose coverage and explain the different enrollment periods. Last, we will talk about how you may be able to save money and where you can find more information. There are some common misperceptions about Medicare. So let's go over a few basic facts about what Medicare is and what it is not. Medicare is a health insurance for older and disabled Americans and currently serves more than 62.8 million people in the United States. It is funded in part by federal payroll taxes paid by employees and employers. The tax is labeled on your pay stub as FICA, F-I-C-A. Medicare is individual insurance, which may be confusing if you're used to getting coverage for yourself, your spouse, and your children through an employer plan. Medicare is not free. You have some costs to pay, which we will cover in just a little bit. Medicare is also not a family health plan. Each person must meet Medicare eligibility requirements as an individual, and each person is covered as an individual. For example, one spouse may turn 65 and enroll in Medicare while the other spouse is not yet eligible. Finally, Medicare is different from Social Security, which is health insurance for people with limited income and resources. And we'll talk about that next. Now, let's quickly touch on Medicaid. Medicaid is a state government program that helps pay health care costs for individuals, family, and children with limited income and resources. Programs vary state to state, but do follow federal guidelines for benefits. Eligibility varies from state to state. Medicaid and Medicare can work together. In fact, some people can have both Medicare and Medicaid. These people are called dual eligible, and we will talk about that a little more later. So we said that Medicare is individual insurance, but who can get it? As you might guess, there are eligibility requirements for Medicare. First, Medicare is for U.S. citizens and residents living in the United States for at least the previous 5 years. You must also meet one of the following requirements. One, be age 65 or younger than 65 with a qualifying disability and have received disability benefits for 24 months, or any age with a diagnosis of end-stage renal disease or ALS. Each individual enrolled in Medicare can get a card with a unique number on it. Numbers are randomly generated and assigned. You can see here what a Medicare card looks like on this particular presentation. We mentioned the term dual eligible. Now we would dive a little more. People who are dual eligible can have both Medicare and Medicaid, and yes, the two programs can work together. If you have both Medicare and Medicaid, the two will work together and may cover most all of your healthcare costs. Additionally, dual eligible individuals may be eligible for special private Medicare plans. For example, people with Medicare and Medicaid can get a special coordinated care plan called dual special needs plans. So we covered who can get Medicare, but before we look at what Medicare covers, let's talk about a situation many of you may be in today, and that's working past age 65. If you plan to work past age 65, your Medicare decision may be different. In fact, you may be able to delay Medicare enrollment altogether. This is generally an option for people who work for an employer with 20 or more employees and have employer health coverage that is considered credible coverage by Medicare. Specifically, your plan's prescribed drug coverage must be as good as or better than Medicare Part D. People who have health coverage from an employer with fewer than 20 employees must enroll at age 65 or they could face late enrollment penalties. But what about if your health insurance is through your spouse? Well, in this case, you may be able to delay or you may still need to enroll at age 65 even if the spouse employer has 20 or more employees. This is because employers can have their own rules for covered dependents. Some employers require covered dependents of Medicare age 65 to enroll in the Medicare in order to remain covered by the employer's plan. You can ask the employer benefits administrator to learn about your option for this type of situation. Now, there are some important things to know about getting Medicare when you continue to work. First off, Medicare and your employer insurance can work together. Medicare will typically be secondary to your employer's insurance until you leave your employer or lose the employer insurance, whichever happens first. Then Medicare will become primary. Second, if you take any part of Medicare, you will no longer be able to contribute to a health savings account. So you need to think carefully about this if you're eligible to delay Medicare enrollment and are going to keep working. Medicare Part A may seem like a great idea to go ahead and get even if you keep working because for most people it's premium free. But if you want to keep contributing to your HSA plan, it may not be the right fit. Finally, Medicare will not cover your spouse or your children. If you decide to take Medicare and also opt to drop your employer coverage, you'll want to talk with your employer's benefit administrator to understand what options they may offer for spouse and children. For example, some employers may offer COBRA. Make sure you know what dropping your employer coverage for Medicare only means for your family. Now let's move on to what Medicare covers. You may have heard about the different parts of Medicare. That's A, B, C, and D. First, we'll explain Medicare Part A and Part B. Then we'll explain the private Medicare and Medicare-related coverage options, which are Medicare Advantage, Part C, Part D prescription drug coverage, and Medicare supplemental insurance or Medigap. First up is Original Medicare. The core coverage provided by federal government has two parts. Part A is hospital insurance. Part B is medical insurance. Let's take a look at each of these, starting with Part A. Part A, hospital insurance, covers service provided during an inpatient hospital stay. Most covered services are listed here on this slide. This includes your room, your meals, and nursing and other services. One important thing you may notice missing from the list is doctor services. That's because doctor services are covered by Part B, even when you're in the hospital. Another thing to put out is that if you want a TV or a phone in your room, you may have to pay for it. Part A doesn't cover these items. It also doesn't cover custodial care, which is care that helps with daily life activities like eating and bathing. Here are some additional important facts about Part A. Part A has a premium, but few people pay for it. Remember the FICA payroll tax that we spoke about earlier? If you or your spouse paid that for 10 or more years, you get Part A premium free. You can't be denied Part A coverage regardless of your health or financial status, and you're covered at any hospital in the country that accepts Medicare. Finally, you need to know a few terms to understand about Part A benefits. Part A covers Part A coverage and costs are based on benefit periods. A benefit period begins the day you are admitted into the hospital and ends after you've been out of the hospital for 60 days in a row. Observation status is another important term. Part A covers hospital stays when you are admitted as an inpatient by a doctor's order, not if you're there for observation, even if you stay overnight. Part B would pay some of these costs. And then there's lifetime reserve days, which are extra covered hospital days you can draw on if you're in the hospital longer than 90 days. The maximum length of stay covered in a benefit period, you get 60 lifetime reserve days. Each can be used only once, but they can be applied to different benefit periods. And we'll come back to these terms in a bit when we talk about cost. Now let's talk about Part B medical insurance. The main coverage services are listed here on the slide, include doctor visits, the tests or exams your doctors may order, and other outpatient services. Also, as we just discussed, Part B covers doctor services when you're in the hospital as well. There are a couple of things to point out here. First, the annual medical wellness visit. This is an opportunity to meet with your doctor to discuss your health status and goals. These things like a regular visit may not provide time for. It's covered at 100% with no copay as long as it sticks to the purpose. If the discussion versus veers off into current health problems like cough, for example, or if you receive additional services that are not part of the visit, like lab tests, procedures, or certain other services, then there may be a cost. It's good to know that this information ahead of time to prevent any surprise billing. The second thing to point out is about medical equipment, also called durable medical equipment or DME. To be covered, The equipment needs to be medically necessary and prescribed by the doctor. It also needs to come from a supplier approved by Medicare. So, in most cases, you can't just buy a walker somewhere and have Medicare pay for it. Talk to your doctor first. Now, here are some additional important facts about Part B. Part B has a monthly premium. If you're receiving Social Security or Railroad Retirement Board benefits, the amount will be deducted from your check each month. Again, we'll talk more about cost in just a minute. Just as with Part A, you can't be denied Part B coverage regardless of your health or financial status. And you may see any provider in the country that accepts Medicare. Finally, Part B covers charges a premium penalty for late enrollment unless you qualify for a special enrollment period. We'll cover enrollment later in the presentation, but some people, including those who work past age 65, may delay Part B enrollment without a penalty. So we've gone over what original Medicare Part A and Part B covers. Now, let's look at what it doesn't cover. Many people are surprised to learn that they will have out of pocket costs, which could be significant depending on the individual healthcare needs. Further, there's no out of pocket maximum, no financial protection with with original Medicare. A serious illness or injury could create real financial stress. Another possible surprise is that original Medicare does not cover prescription drugs, which can be a big expense as we get older. Other non-covered services include routine dental, vision, and hearing care. Even from these simple examples, you can see that original Medicare doesn't cover everything and that out-of-pocket costs for healthcare items and services could add up and take a bite out of your budget. The good news is that you have options for other coverage that can cover other key things like prescription drugs and that may help turn that budget bite into just a little nibble. On that note, we're now ready to talk about what Medicare Part C, Part D, and Medicare supplemental insurance plans cover and how they may work when you're deciding on Medicare coverage to choose. Now we're going to see how Part C or Medicare Advantage Part D and Medicare supplemental insurance or Medigap plans fit into the picture. You have two options for more coverage. Option number one is to add Medicare supplemental insurance and or a Part D prescription drug plan to original Medicare. Medicare supplemental insurance will help pay some of the out-of-pocket costs not paid by Medicare. Part A and B. Part D will cover prescription drugs. Option two is to choose a Medicare Advantage plan. Part C. Most Medicare Advantage plans include drug coverage and additional benefits such as routine dental and vision coverage. Before we delve into these options, I want to point out that all three of the components shown on the slide, Medicare supplemental insurance, Medicare Advantage plans, and Part D plans, are offered by private insurance companies. What this means in part is that there may be a number of plans to choose from, and they may vary in coverage and cost. By contrast, original Medicare is administered by the federal government, and benefits and costs are the same for everyone. Medicare Advantage and Part D plans are approved by Medicare and held to the standards set by Medicare. These private plans options are provided to give you more choices and the ability to fill in for what isn't covered by original Medicare. Now, we'll circle back to this graphic later, but now let's continue through the alphabets and talk about Medicare Advantage, otherwise known as Part C. Now, we're going to see how Part C of Medicare Advantage, Part D, and excuse me, Part C is Medicare Advantage. It is an alternative to original Medicare and offers another way to get your Medicare Part A and Part B benefits, plus more. You still have Medicare, and Medicare contracts with the plan to administer your Part A and Part B benefits. You also continue to pay your Part B premium directly to Medicare. Plans are offered regionally, often in a county or state by private insurance companies. Most plans include other benefits like prescription drugs, dental and vision. All benefits are covered under one plan. By law, Medicare Advantage plan must provide all the benefits that original Medicare does. So plans combine Part A and Part B coverage into one package. One exception is hospice care, which is covered by Part A even when you have a Medicare Advantage plan. Most Medicare Advantage plans also include built-in prescription drug coverage or Part D, which we'll talk about next. Finally, Medicare Advantage plans may also offer additional benefits, including coverage for dental, vision, or hearing care, as well as fitness programs. The result is an all in one plan similar to what you may be used to having through an employer. Now, there's a different type of Medicare Advantage plan. Most are coordinated care plans where care is delivered through a provider network. You may get care outside the network, but you may pay more or even the full cost. Most coordinated care plans are HMO or PPO plans. HMO plans have a network of doctors, hospitals, and other care providers you use to receive covered services. POS, which is point of service plans, are a type of HMO plan that also let you see providers outside the plan's network for certain covered services. And then you have the PPO plans, which have a provider network you can use, but also offer more freedom to see providers outside the plan network for all covered services. Now, special needs plans are designed specifically for people with certain healthcare needs. Plans we talked about earlier is a kind of special needs plan, specifically for those with both Medicare and Medicaid. There are also chronic special needs plans for people who have certain chronic conditions, such as diabetes, institutional special needs plans for people living in a skilled nursing facility, and institutional equivalent special needs plans for people living in assisted living facility and need the same kind of care as those lived in a skilled nursing facility. Then we have the private fee-for-service plans, typically offered more flexibility in choosing providers than other types of plans do. In general, you can get care from any Medicare-approved provider who accepts the plan's terms and conditions. Now, Medicare Savings Account plans combines a high deductible health plan with a medical savings account. They generally offer more choice with more financial risk. Now, here are some additional things you need to know about Part C. You must be enrolled in both Part A and Part B to be eligible for Medicare Advantage plan. You must also live in the plan's service area, and you can't be denied coverage. You may pay a premium to your Medicare Advantage plan and continue to pay your monthly Part B premium to Medicare. It's easy to get confused by this. Now, the plan provides Part A and B coverage, but you still need to enroll in Part A and B. As we mentioned, you're still in the Medicare program. Medicare contracts with the plan to administer your benefits. Importantly, unlike original Medicare, every Medicare Advantage plan has an annual out-of-pocket maximum for Part A and Part B services covered by the plan. Once you pay this amount, the plan covers the entire cost for these services for the rest of the year. Now keep in mind, the out-of-pocket maximum doesn't apply to your monthly premium or prescription drug costs or any costs for additional benefits not covered by original Medicare, like routine eyewear or hearing aids. Medicare sets standard maximum, but many plans cap your costs below this amount. The out-of-pocket maximum limit in 2024 is $8,850. Now let's move on to Part D, which is prescription drug coverage. An easy way to think about this is D for drugs. Remember, drugs are not covered by original Medicare, except in select circumstances. You can get drug coverage in two ways: through a separate standalone Part D plan or through a Medicare Advantage plan, as we just discussed. Standalone Part D plans can work with original Medicare, Medicare supplemental insurance plans, and select Medicare Advantage plans, including private fee-for-service plans and medical savings account plans, without drug coverage. And like Medicare Advantage plans, Part D plans are offered by private insurance companies. Each Part D plan or Medicare Advantage plan that includes drug coverage creates a list of specific drugs that it will cover. The list is called a formulary. Each plan has its own list of covered drugs, but every plan must cover a range of both generic and brand name drugs that are generally needed by people on Medicare. Plans also cover all commercially available vaccines, like the shingle shot, that are covered by Part B. Part B covers things like flu and pneumonia shots. Many Part D group the drug they cover into levels or tiers. Drugs in different tiers have different cost. For example, you may pay more or higher copay or coinsurance for a tier 5 drug than for a tier 2 drug. Also, plans may have a deductible for some tiers and not for others. When choosing a plan, it's important to make sure that drugs you take are covered on the plan and understand the costs, which can vary from plan to plan. Let's take a minute here to talk about the different Part D cost stages, especially the Part D coverage gap, commonly called the donut hole, since it may be confusing for some people. There are four Part D coverage stages. The stage you're in determines the amount you pay when you fill a prescription. Each stage has a dollar limit set by Medicare that marks when you exit the stage and enter the next. The limits shown on the slide here can change from year to year. You begin in the deductible stage, if your plan has one, where you would pay the full cost for drugs, or in the initial coverage stage, where you usually pay a copay. If your drug costs reach the limit for initial coverage stage, then you would enter into the coverage gap, where you pay a greater share of the cost for your drugs, which is normally 25% for generic and 25% for brand name drugs in 2024. Not everyone enters the coverage gap. If you do and your drug costs reach the limit, then you enter the catastrophic coverage stage and you pay reduced copays for the rest of the year. The cycle starts over on January 1. A few final points about Part D. You are eligible to join a Part D plan once you are enrolled in Part A, Part B, or both. Plans often have pharmacy networks that you need to use to get the plan's pricings. Plans may vary quite a bit in terms of what specific drugs they cover and what your costs may be. A final key point is that you could be charged a premium penalty if you are late enrolling in Part D, unless you qualify for a special enrollment period. I'll say more about this in a few minutes. Now we'll come to the Medicare supplemental insurance, or what is often called Medigap. Medicare supplemental insurance plans, which are often offered by private insurance companies, are different from the plans we've discussed so far. As the name says, they're supplement Medicare. So they are not Medicare plans in and of themselves. Medicare supplemental insurance plans help to pay some of the out-of-pocket costs that come with Medicare, like deductible and coinsurance. They can only be used with the original Medicare, not with Medicare Advantage. Plans are standardized by the federal government. There are 10 plans labeled with letters Plan A, for example. Every plan of the same letter provides the same benefit, no matter what insurance company offers it. For example, Minnesota, Maine, Wisconsin are exception to the rule, as these states standardize their plans differently. It's also important to note that Plan C and Plan F are only available to individuals who were eligible for Part A or turned 65 before January 2020. Now, here are some costs that Medicare supplemental plans may help with and some that may not. You'll see that they help pay for coverages already provided by original Medicare and may extend it in some cases. As with extra hospital days, Medigap plans can help with Part A deductible, original Medicare copays, coinsurance, and provider access charges, costs of blood transfusion, and costs of foreign travel. Emergency. Additionally, some programs may cover Part B deductible costs, but only for those individuals who were eligible for Part A or turned 65 before January 2020. But except for foreign travel emergency coverage, Medigap plans don't fill in for what original Medicare doesn't cover, such as dental, vision care. Some plan providers may offer value-added services for free or a discounted basis, but they are not part of the Medigap plan directly. Now, this slide on this table, you may have help you to visualize with this side. If not red, which calls different standardized plans to help with, and the level of coverage. 100% means 100% coverage. And the main point here is that Medigap plans vary. Example, you have Medigap plans with Plan A, Plan B, Plan D, Plan G, Plan K, Plan L, Plan M, Plan N. Plan C and F are not available unless you turn 65 and before January 1st of 2020. Now, based on the slide, you can see that these plans do differ based on what is covered. Now, for some fast facts. You must be enrolled in both Part A and Part B to be eligible for a Medicare supplemental insurance plan. And you must choose from the plans offered in your state. Also, there's a set enrollment period when you can be denied coverage or charged more based on your health history. This is in a minute when we cover the enrollment period. Medicare supplemental insurance coverage is nationwide and goes with you wherever original Medicare does. And while plan benefits are standardized, each plan sets its own premium. The amount can vary even from the same coverage. So you and your friend who lives in a different state may both have Plan F, but your premiums may be very different. In general, through among the different standardized plans, the broader the coverage, the higher the premium. So, for example, Plan A, which we said provides selective help, may have a lower premium than Plan F, which cover more of your cost. Finally, you must continue to pay the Part B premium to Medicare. Now let's talk about Medicare cost. We'll start with some definitions. Most people are familiar with premium, deductibles, and copays, which are defined here. Coinsurance may be a less familiar term. It's an amount you pay when the cost of covered services is split with you. It's determined by percentages, for example. The cost of service is covered 80% and you pay the remaining 20%. You may have some or all of these types of costs with Medicare, again, depending on your coverage. Finally, if you choose a Medicare Advantage plan, Part D, or Medicare Supplemental Insurance Plan, these are the costs you may pay for each. Costs will vary by plan and by provider. Let's start with Medicare Advantage or Part C plans. With Medicare Advantage plans, some plans have low to zero premium. Some plans have deductibles, and some others do not. You'll want to look at a plan carefully to see if they have either premium or deductible and how much they are. Medicare Advantage plan may also charge copay or coinsurance amount for covered health services. Medicare Advantage plans also have an out-of-pocket maximum, which helps protect you financially by limiting your out-of-pocket costs. Finally, with Medicare Advantage plans, you will still pay the Part B premium to Medicare. With Part D prescription drug plans, you may have a monthly premium and deductible or copay and coinsurance amounts. Part D plan costs will vary by plan and provider. Costs may also vary for your deductible and copays. If it's a plan has a tiered formulary, in this situation, drugs may have different and or higher deductible on a higher tier, and copays may be specific to certain drugs or tiers as well. And finally, Medicare supplemental insurance plans or Medigap plans may charge a monthly premium and also have a deductible and copay amounts. There are different types of Medigap plans, and private insurers set their own premiums, so you'll need to review the specific plan carefully to find out what your costs will be. Some Medigap plans may also cover protection for out of pocket costs, but again, each plan and providers is different, so be sure to look closely before purchasing. We have covered a lot. Hopefully, you now have a basic understanding of the different parts of Medicare, Medicare supplements insurance, and the costs you could pay. Now what? Well, you get to put the different coverage options together to meet your needs. Like this, there are 7 combinations on this slide. Right away, you can see choices with A and B combos, 1 through 4, or with C combos, 5 to 7, but not with A and B and C together. Remember, Medicare Advantage Part C is an alternative to original Medicare Parts A and B, and Medicare Supplement Insurance only works with the original Medicare, not with Medicare Advantage. Part D gets along with everyone. But note option 7 is only available with certain Medicare Advantage plans. Now that we reviewed the coverage option, let's go back to the graphics we looked at earlier, only as one whole picture. Step 1 is to enroll in the Medicare program. Again, original Medicare consists of Part A and Part B, and it provides by the federal government. Step 2 is where it gets interesting. If you want more coverage than original Medicare provides, if you do, like we saw on the previous slide, you have 2 options. Option 1, add plans to original Medicare. Or option 2, choose a Medicare Advantage plan instead. You can get Part D drug coverage with either option. So the choice when looking at additional coverage is really between Medicare supplement insurance and Medicare Advantage. Let's look at this more closely. Let's think about this choice in terms of coverage, cost, and convenience. Coverage provides choice is one of the main considerations between these coverage options. Medicare supplement insurance helps pay for care from providers nationwide. Medicare Advantage plans generally have a provider network and each serves a set of geographic area. Another key consideration is what you need to coverage for. Do you want coverage for prescription drugs, dental, and vision? So the question to ask, am I able to get most of my healthcare needs met near home? Am I willing to change doctor if mine isn't set on a plan in the network? Do I want coverage for additional healthcare services like dental, vision, hearing, and fitness? Now let's talk about cost. Both options help manage cost, but in very different ways. With the Medigap plan, you may pay a higher premiums than with the Medicare Advantage plan, but other costs may be lower. With the Medicare Advantage plan, you pay co-pays, but the premium may be low, and you're protected by an out-of-pocket maximum. So the question you're going to ask is, how often do I use my healthcare services? Would I rather pay higher premiums even when I don't use the services? Or would I rather pay copays when I do use the services? What level of Medicare supplement insurance can I afford? The next last is convenience. Many people who opt for Medigap plans also buy a Part D plan. With the original Medicare, that's three different plans. With Medicare Advantage plans, it's usually just one. So the question you ask, which coverage option is the best fit for my lifestyle? How do I feel about working with multiple insurance carriers? What Part D plans are offered where and where I live? And what Medicare Advantage plans are offered? Whether you choose Medicare supplemental insurance or Medicare Advantage, be sure to consider your needs and budget and to compare plans before making a decision. Or you can call us at 1-833-444-4139 to assist. Now, once you decide on coverage, you're ready to enroll. So let's explore the different enrollment periods. Most people first enroll in Medicare during their initial enrollment period, or IEP. Your IEP is 7 months long. It includes your 65th birthday month plus the 3 months before and the 3 months after. If your birthday is on the 1st, then your enrollment period begins and ends 1 month earlier. If you qualify for Medicare due to disability, then your IEP includes your 25th month of receiving benefits, the 3 months before, and the 3 months after. You are enrolled in Medicare Parts A and B automatically if you receive Social Security or Railroad retirement benefits at age 65. You'll get your Medicare card in the mail. Otherwise, you need to sign up yourself online, on the phone, or at your local Social Security office. During your initial enrollment period, you can also enroll in additional coverage. Medicare Advantage plans, Part C, a Medicare prescription drug plan, Part D, or Medicare supplemental insurance. To get any of these three plans, you'll need to enroll directly with the private insurance company offering the plan, or contact the broker, like ourselves, at 1-833-444-4139 to assist. A final note, you may refuse or delay Part B enrollment and take just premium-free Part A. This may be a good idea for people who have employers or other credible coverage. Some employers require you to take full benefits, Part A and Part B at age 65. You also may join a Medicare Advantage or Part D plan during your IEP, which is your initial enrollment period, if you're eligible. Ensure if you decide to delay that, doing so won't mean paying late enrollment penalties later on. It's important to pay attention to the timing of your enrollment to avoid late penalties. And we'll talk more about the penalties in a minute. Now, if you miss your IEP, your initial enrollment period, don't panic. You have another chance to enroll called the General Enrollment Period, or GEP. The GEP is January 1st to March 31st of every year. You can enroll in Part A, Part B, or both. If you're eligible, you can join a Medicare Advantage or Part D plan until June 30th of the same year. Late enrollment penalties may apply depending on the timing, and again, we'll get into that in a minute. You must be enrolled in both Part A and Part B to be eligible for Medicare supplemental insurance plan. You're not subject to medical underwriting for 6 months after you enroll Part B at age 65 or older. You can still apply for a Medicare supplemental insurance plan after this time period, but you may be denied coverage or charged more based on your health history. Some states may allow for additional open enrollment periods. Now, we talked about working past 65 a bit earlier and how you may be able to delay. If you qualify for Medicare provides a special enrollment period for people who work and have employer coverage past age 65. You have 8 months to enroll in Part B and Part A if you haven't already. You may enroll in a Medicare Advantage plan, Part D, prescription drug plan within the first 2 months. It's important to pay attention to this timing. As we mentioned, both Part B and Part D charge late enrollment penalties. The Part D enrollment deadline is especially important since it happens quickly and can sneak on you. One more thing, make sure your employer provides you with proof of credible coverage. That's proof of credible drug coverage. This means it is at least as good as Part D provides. If your drug coverage doesn't meet the standard, you could be penalized. Remember that your 6 month Medicare supplemental open enrollment will be triggered once you are enrolled in Part B. Also, you must enroll in both Parts A and B before you can enroll in a Medicare Advantage plan. So we mentioned penalties a number of times. Let's take a closer look at them. Part A, Part B, and Part D may charge late enrollment penalties. The Part A penalty doesn't apply to many people since most of us get Part A premium free. But for those who have to pay, the penalty is an additional 10% of the premium amount. You pay the penalty for twice the number of years you could have had Part A but didn't sign up. The penalties for Part B and Part D could apply to more people. It's important to understand the enrollment periods we just discussed and to enroll on time in order to avoid them. The Part B penalty is an additional 10% of the premium for each full 12 months period you could have Part B but didn't. Unless you qualify for a special enrollment period, you pay the penalty for as long as you have Part B. Now, Part D penalty is an additional 1% of the current premium for each month you're late. You pay the penalty for as long as you have Part D. Remember again, you need to have credible drug coverage as good as Part D to avoid this penalty if you enroll after your initial enrollment period. So hopefully you enrolled on time and with no late penalties, and that's it, right? Well, not exactly. Medicare is not a one and done decision. Things may change in your life, your health, your finances, or even Medicare or your plan. So it's important to review your coverage every year to see if it will work well for you going forward. You can change your coverage choices if you decide to during Medicare annual enrollment period, which is October 15th through December 7th of every year. The new coverage goes into effect on January 1st. The kind of changes you can make are listed on the slides, and we will not go into these too deeply, but the main message is that Medicare provides this annual enrollment opportunity so you can keep your coverage up to date with your life and your needs. The Medicare Advantage open enrollment period is specifically for Medicare Advantage plans members and runs from January 1st to March 31st. You must be a member of a Medicare Advantage plan on January 1 to be eligible for this enrollment period. During this time, you may switch to a different Medicare Advantage plan, or you can drop a plan and go back to original Medicare, Parts A and Parts B. If you return to original Medicare, you also may enroll in Part D plan until that March 31st. You may enroll in a Medicare supplemental plan as well. You only you may only make one coverage change during this enrollment period. The next opportunity is the fall annual enrollment period, unless you qualify for a special enrollment period. Now, Medicare offers a special enrollment period listed as an SEP for qualifying life events when life doesn't happen on Medicare's schedule. Are certain situations, such as moving to a new home, or certain changes in your health care coverage or health, can qualify for a special enrollment period. In most cases, you have 2 months from the date of a qualifying event to make a coverage change. During a special enrollment period, you may join, switch, or drop a Medicare Advantage Part C or prescription drug plan Part D. However, there may be some restrictions depending on how you qualify for the special enrollment period. Again, we won't go into this much more. The main point is that Medicare provides for times when you might have to change your coverage outside of the usual fall and enrollment period. Now, we talked about your Medicare coverage option, the costs you may have in enrolling. Now, let's talk about ways to help you save money. One way to help you save money is to do your best to live a healthy lifestyle and take care of your health. Medicare covers a range of preventative services, many at no additional cost to you. Learn what they are and take advantage of them. You may also be able to save money by choosing your provider from within your plan's network, if you have one. If not, make sure that your providers accept Medicare assignment and won't charge you beyond what Medicare will allow. And then there's a drug costs, which are concern for many people. As your doctor or pharmacist about ways to save. You may be able to switch to a generic or a low tier drug or get a better price by using a different pharmacy. And always, if you're in the hospital, ask whether you are inpatient or there for a observation. It makes a difference in how your care is covered and may have an impact on your cost. Now, if you need it, you can qualify or you may be able to get help with paying some of your healthcare costs. There are several programs shown on the slide, and we're going to go over a few of those. One is for extra help, the other is Medicaid, the other is Medicare savings programs, and the other is programs for all-inclusive care elderly PACE. A good place to start is with a broker or your state health insurance assistant program, SHIP office. You can find the number at shiphelp.org or by calling us here at 1-833-444-4139. Or call the Medicare number that's shown on your card. Now, we've had talked about a lot, and I try to answer some questions at the end of the presentation today, but you may have more as time goes on. So here are some places to go for more information. One is to contact your broker or call us here at 1-833-444-4139. That's HealthNet Co. or HNCMedicare.com is our website. Because we're with you today because at United Healthcare, we're passionate about helping people have everything they need to make informed decisions. And as a partner with United Healthcare, we want to make sure we're educating you. Medicare Made Clear is a United Healthcare educational program and dedicated to providing information and resources to help you get answers to your Medicare questions. You can find us online and get a regular update by signing up for our newsletter and following us on social media as healthnetco.com or unitedhealthcare.com. You can also find help information at medicare.gov, the official government website for Medicare, or you can call Medicare at the number listed here. You may want to talk to your state health insurance assistance program to see if you qualify for additional financial assistance, or contact Social Security or your state Medicaid office to learn about other assistance programs, or just contact us here at HealthNetCo at 1-833-444-4139. Now, I want to take a moment to thank you for joining us today. And if you want to pass this information on to a friend or family member, visit us online at HNC Medicare for our next event where we have a lunch and learn to talk more about Medicare. I'm Dexter Brooks, and have a great rest of your week. Thank you.